Today we are going to discuss something about stroke rehabilitation. Almost each and every one of us has come across stroke patients in our daily life, and people who are in the medical field or the healthcare workers are almost very habituated in taking care of stroke patients. So stroke is the third most common cause of death after cancer and cardiovascular disease. We can define stroke as sudden occurrence of damage to a part of a brain which is non-traumatic in nature due to a vascular cause. Now, this vascular cause can be either be an ischemic stroke or a hemorrhagic stroke. Ischemic stroke is something where the blood flow to a certain part of the brain is stopped because of coagulation or a clot in the arteries. And hemorrhagic stroke is when because of uh, excessive blood pressure or because of an aneurysm, there's a rupture of an artery which supplies to the brain. Now, we all must know what are the common features of stroke, and these are the certain common features of stroke that can be weakness of a part or a whole of body. Sometimes stroke patients might present only with the weakness of the facial muscles leading to a deviation of the mouth. There might be speech disturbance. Speech disturbance can be a sensory speech disturbance where the patient is not able to comprehend whatever he sees or listens. It can be a motor deficit where the patient is not able to speak whatever he wants to. He might be finding difficulty in finding words for a specific thing. There might be dysarthria, and in some cases, people might have complete aphonia where any voice from the larynx doesn't come out. Then sometimes might be a visual deficit that will again depend upon the part of the brain that had been affected because of the stroke. Some people might have seizure. Seizure can be of different types. We won't go into the details, but yes, seizures or fits that are commonly known as can be a feature of a stroke. There again, some people complain of headaches, sometimes very severe headache in patients who have a subarachnoid hemorrhage. Then patients who might have a severe stroke, they just go into coma, and obviously swallowing difficulty, which might be presented as drooling from the side of the mouth and